Good morning, sir. I, Shalari Silvestre, BSN 1-11, and will be doing an interview about health history taking of my patient. Without further ado, let's begin. Good morning, ma'am.
Good morning.
I, Shalari Silvestre, your student nurse for today, and I will be doing an interview about your health history. Before we proceed, ma'am, I will be doing the hand hygiene for us to do not spread the microorganism. So, before we proceed, ma'am, I need to identify some of your personal information. What is your name, ma'am?
I'm Sarah Mary Silvestre.
Where do you live, ma'am?
I live in Santa Barbara, San Antonio, Nueva Ecija.
Okay. How old are you, ma'am?
I'm 21 years old.
Okay. Source and reliability. Who's with you today, ma'am?
I'll be my family, sisters, and grandmother.
Reason or seeking care? What are your problem, ma'am?
My problem is diabetes, a disease of diabetes. I'm seeking for care, which is to provide and to manage the disease.
Present history, ma'am. Do you have the history of present illness?
Present illness. For now, I still do have the diabetes.
Past health, ma'am. In the past, ma'am. How's your health?
Has my health? My health is apparently moderate, but not really a normal.
Child illness. During your child, did you experience from an illness?
No.
Okay. Accident or injuries? Have you ever been involved in injuries or been in accident?
No.
Serious or chronic illness? Have you ever had a chronic disease?
None.
Hospitalization. Do you have hospitalization before?
Yeah, for a monthly check-up or even week check-up.
Operation, ma'am. Do you have operation before?
None.
Let's move on to the health history. Recently, are you experiencing some of these diseases as follow? Heart disease, allergies,
None.
high blood pressure,
None.
asthma,
No.
stroke,
None.
obesity,
No.
diabetes,
Big yes, yes, yes.
alcoholism,
No.
blood disorder,
No.
mental illness,
No.
breast cancer,
No.
sexual disorder,
None.
cancer,
None as well.
kidney disease, tuberculosis,
None.
arthritis.
No.
For the review of system, about part 1 and part 2, let's go to the part 1. General overall health status. Do you experience weight gain for the past 3 months?
Slightly. Yes.
Weight loss for the past 3 months?
Weight loss. Sometimes.
Fatigue,
Yes.
weaknesses or malaise,
No.
fever,
No.
chills,
No.
night sweats.
No.
For the skin, mom, do you experience history of skin diseases like eczema, psoriasis,
None.
Pigment or color change?
None.
Change in mole?
None.
Excessive dryness, ma'am?
None.
Excessive moisture?
None.
Pruritus?
No.
Excessive bruising?
No.
Rash? Lesion? For the skin, ma'am, do you experience recent loss in your hair?
Yes.
Change in texture?
No.
For the nails, ma'am, do you experience change in shape? Change in color? Brittleness? For the head, do you experience frequent or severe headache? Okay. History of head injury, ma'am?
No.
Dizziness or vertigo, ma'am?
Sometimes.
Okay. Syncope or faintness?
No.
For the eye, ma'am, do you experience difficulty with vision?
No.
Eye pain?
Sometimes due to overuse of glasses or even phones and cell phones.
Okay. Double vision, ma'am? Redness or swelling?
No.
Watering or discharge? Glaucoma? Cataracts?
No.
Wear glasses or contact lens?
Yes.
Everyday use it?
When it comes to school, yes. So especially lectures and RLE or clinicals, but most likely, yes.
What do you feel, ma'am, when you wear glass or contact lens?
Wearing glass is in a first time or first time around when you are going to wear your glass. It's very unusual, or sometimes feel na you will irritated because it's something heavy in your eyes like that. But along the way, it's just okay, nasasanay na ako. Ganun. Just
For the ear, ma'am, do you experience earache,
no,
infection in your ears,
no,
discharges,
no,
ringing of ears,
no,
vertigo,
no,
hearing loss,
no,
use of hearing aid po? For the nose and sinuses po, do you experience discharge,
no,
severe colds po,
no,
sinus pain,
no,
nose bleeding,
no,
change in sense of smell,
no,
nasal obstruction,
no,
allergic rhinitis?
none,
Okay po, let's move on to the mouth and throat. Do you experience mouth pain?
no, never.
Okay. Frequent sore throat?
Frequent sore throat, sometimes.
Bleeding gums?
No, never.
Toothache?
Toothache, sometimes, and it's overeating or excessive eating of chocolates or sweet foods or sweet drinks.
What do you do, ma'am, to prevent it?
To prevent toothache, of course, brushing
That's good.
the teeth every day, most especially after eating from breakfast, lunch, as well as dinner, or before you are going to bed. So that's one of the most important or significant to
Very good.
prevent the toothache.
Very good po, ma'am.
Okay.
Lesion in mouth or tongue?
Never.
Difficulty in swallowing or dysphagia?
No.
Hoarseness of voice?
No.
Altered taste? Tonsillectomy?
Never.
Dental caries or cavities.
Dental caries and cavities is very usual. Okay, but I did. It has sometimes, and also always.
Okay, ma'am. Use of dentures or braids.
Yes.
Use of dentures or braids.
Never.
Use of dental braces.
Never.
Okay, ma'am. For the neck, ma'am, do you experience pain in your neck?
Yeah, sometimes when I'm oversleeping,
And
like sleep neck, spur ache.
what do you do to remove this or prevent this?
Sometimes I do like exercise in my neck, for
That's
especially.
good, ma'am.
Mm-mm.
You need to exercise to be good your
Be better and to have a good
limitation of motion. Limitation of motion, ma'am, in your neck. Okay. Lumps or swelling,
never,
enlarged or tender nose.
never.
Do you have goiter, ma'am?
None.
For the breast, ma'am, do you experience pain in your breast?
Pain? Yes, especially when before the menstruation and during the menstruation period.
Okay, ma'am. Lump po.
Lumps? No.
Nipple discharge.
Never.
Rush.
Brush? No. Never.
History of breast cancer.
No, never.
Any surgery on your breast?
None.
Okay, that's good, ma'am. Last mammogram.
I never experienced mammogram.
Okay,
So
ma'am.
never.
Okay. Tenderness, lump swelling in the axilla.
Axilla? Never.
Okay po. Let's go to the part 2. Respiratory system. Do you experience history of lungs disease like asthma, emphysema, bronchitis, pneumonia, tuberculosis?
Never.
Okay, ma'am. Chest pain, wind breathing.
Chest pain? I experience sometimes chest pain when I did a jog, but it is sometimes, it, and then and not always this, not always happen. So it just does sometimes.
Okay, ma'am. Wheezing or noisy breathing.
No, never.
Shortness of breath.
Never.
Okay. Cough. Cough. Sputum production.
No.
Hemoptysis.
Hemoptysis? No.
Okay. Toxin or pollution exposure.
Pollution exposure, usually yes. We exposed to the pollution, and I should. It's always, but this time, sometimes,
Last chest x-ray po, ma'am.
never. No.
For the cardiovascular system, ma'am, do you experience change chest pain?
No.
Palpitation po, ma'am.
Yes, when it comes to excessive drink of caffeinated, caffeinated, such as coffee.
Ano? Dyspnea po.
No.
Frequent urination during night.
No.
Edema.
No.
History of heart disease.
The history of heart disease, no, none,
Hypertension.
none,
Anemia po, ma'am.
none. As well.
That's good. For the peripheral vascular system, do you experience coldness, numbness, and tingling, swelling of legs,
No.
discoloration of hand and feet, ma'am,
No.
varicose vein,
Some parts of my feet, and then parts of my thighs.
left or right, ma'am?
Left.
Okay, ma'am. Pain on legs when walking and exercise will relieved by rest, or intermittent claudication.
No.
History of thrombophlebitis.
Thrombophlebitis I never had. Never.
Do you have ulcer in lower extremities?
No.
So let's move on to the gastrointestinal system. Do you experience loss of appetite to eat?
Yeah, sometimes.
Okay. Food intolerance.
No.
Okay. Dysphagia, ma'am.
No.
Heartburns. Burns.
Heartburns. I did sometimes.
Indigestion, ma'am.
Yes, if overeating. It happens. Indigestion.
What do you feel, ma'am, when you have indigestion?
I feel so, it's like a heavy thing and I can't breathe. There's something in my stomach and indigestion happens kasi when it comes to I never digest those foods that we intake. And then sometimes if the indigestion happens, I'm so bloated. That's what I
Pain associated with eating, ma'am.
never.
Abdominal pain.
Never. Sometimes.
Ay, okay. Nausea and vomiting.
Nausea and vomiting. Yes.
History of abdominal disease.
Never.
Flatulence.
Of course. Yes.
Constipation, ma'am.
Yes.
Diarrhea, ma'am. Black stool, ma'am. Rectal bleeding, ma'am.
No.
Hemorrhoid, ma'am.
No.
Use of antacid, ma'am.
Never.
Use of laxative, ma'am.
Never as well.
Let's move on to the urinary system. Do you experience frequency or avoiding at loose intervals?
No.
Urgency or strong desire to void even with small amount of urine in the bladder?
No.
Lituria or the
No.
number of dysuria, ma'am, yung difficulty, painful for voiding.
Never.
Polyuria, excessive amount of urine or more than 1,500 ml per day. Oliguria, voiding of decreased amount of urine, less than 30 ml per hour or less than 800 ml per day. Resistancy or straining, ma'am.
Resistant? No.
Narrow stream of urine. Change in color of urine, katulad ng cloudy, reddish, and brown.
No.
Incontinence, inability to control body. Follicular, daytime, quick frequent scanty urination in children.
No.
History of urinary disease.
No.
Pain in flank, groin, suprapubic, pubic region or low back.
No.
History of surgery in urinary system.
Never.
Let's move on to the female genital system. Amenorrhea, mom.
Amenorrhea.
Absence of menstruation.
Never.
Okay. Do you experience menorrhagia, excessive bleeding during menstruation?
Not yet.
Okay, ma'am. Do you experience vaginal itching?
Never.
Vaginal discharge or wheaties, fizzy and full yellowish, greenish?
Yes.
Okay. Menopausal sign and symptoms.
Never.
Postmenopausal bleeding. Age at menarche, onset of menstruation. How old are you when you have menstruation?
That was 15 years of age when I was.
Last menstruation period, ma'am.
Last January 12, 2021. 2022, rather. January 12, 2022. Because it's 2022.
Ma'am.
Yes.
Let's move on to the musculoskeletal system. Do you have experience of arthritis?
No.
History of pain, stiffness, and swelling of joints?
No.
Joint deformity?
No.
Limitation of motion joint? Noise with joint motion? Muscle pain cramps?
No.
Muscle weaknesses?
Sometimes.
Problem with walking?
No.
Back pain?
Yes. Definitely.
Okay. Stiffness and limitation of motion muscle?
Yes.
History of dyslexia disease?
No. Never.
Perform exercise, walking, aerobics, dancing, running, jogging, bicycle, riding, treadmill.
Yes, I did jog. I did exercise as well.
Okay, that's good. Difficulty in performing ADL or activities of daily living, grooming, feeding, toileting, dressing.
Of course. Yes.
Any
Sometimes.
any mobility ideas use wheelchair, crutches,
No.
neurologic system. Do you experience history of seizure disorder?
Never.
History of stroke?
Never.
Okay, ma'am. History of painting? Blackouts? Ganun.
Yes.
Weakness in any body part?
Yes.
Tic or tremor?
Yes.
Paralysis?
Never.
Coordination problem, ma'am?
Coordination problems sometimes.
What do you feel, ma'am, when you have coordination problem?
Coordination problem is it happens, but not really, but it will happen when it comes to never coordinate like my extremities
Okay, ma'am.
and limbs, lower and upper.
Parehas ko siya. Numbness and tingling po.
Never.
Memory disorder po, ma'am. Yung memory, remove memory.
No, never.
Disorientation, ma'am. Person, time, and place.
Disorientation, sometimes.
Nervousness, ma'am. Nervousness, ma'am.
Yes.
Mood change po, ma'am.
Yes, especially when it comes to menstruation, before and during.
Depression, ma'am.
Never.
History of mental health dysfunction.
None.
Hallucination, ma'am.
No.
Now, good, ma'am. Let's go to the hematologic system, ma'am.
Okay.
Do you experience bleeding tendency of skin or mucous membrane?
No.
Excessive bruising, ma'am.
No.
Lymph node swelling,
Never.
exposure or to toxic agent or radiation. Blood transfusion.
No.
Reaction to blood transfusion.
None.
History of blood disorder. Anemia, leukemia. Okay, ma'am. For the endocrine system, ma'am, do you experience history of diabetes mellitus?
Yes.
Okay. Excessive urination.
No.
Okay. Excessive thirst or polydipsia.
No.
Excessive hunger. Polypedia.
Yes.
Oh. History of thyroid disease.
No.
Intolerance to heat and cold. Change in skin pigmentation and texture. Excessive sweating. Weight gain with loss of appetite to eat.
Sometimes.
Weight loss with increase of appetite to eat.
Never.
Nervousness. Tremors. Enlarged neck. Goiter.
Never.
Need for oral hypoglycemic agents or anti-diabetic medication. Need for oral hypoglycemic agents.
Not that much.
For the sexual health, mom, do you experience presently in a relationship involving intercourse,
Never.
dyspareunia, or painful sexual intercourse for female?
Never.
Any changes, problem in erection or ejaculation? So, not good for you. Use of let's move on now. Coping and stress management. Do you experience stress?
Yes.
Okay. Describe stress and life now. Can you please describe your level of your stress?
Moderate.
Moderate, ma'am. Okay. Change in past year. Do you think it changed in the past year? Your stress?
Yes. It can be.
Method to relieve stress. What are the methods to relieve your stress?
I did the yoga and for exercise, as well as if I feel too heavy in my weight, I should jog or did jogging.
Are these methods helpful to you?
Very, very.
For the personal habits, ma'am, daily intake of coffee.
Yes.
Do you experience smoke cigarettes?
No.
Drink alcohol?
No.
Any use of street drugs?
No.
For the environmental hazard, ma'am, housing and neighbors, type of structure, live alone, no neighbors. Do you any, ma'am? No. For the intimate partners, ma'am, violence, do you have?
I don't have partners.
Okay. For the occupation, ma'am, do you have occupation?
None.
Okay.
I'm still a student.
Okay, ma'am. For the perception of own health, how do you define health?
Health. I'll define health that is very significant for us people or the human being. When it comes to health, we have to provide, to manage, and to make care of ourselves. So, in accordance to World Health Organization, health is a state of physical, mental, and well-being, not merely the absence of disease, but for informity.
Okay po, ma'am.
Mm.
View of health now, ma'am.
Yes?
View of health now.
Do you?
Today, ma'am, view your health now.
My health is not so fine, but in just a middle or it's moderate. Well managed.
What are your concerns, ma'am? Again?
Concern? My concern is the describing of the interview. My concern is to sick, prevent, and to manage, to control the disease, so not to not progress more.
Excuse me, po. What do you expect will happen to your health in the future? What do you expect will happen to your health in the future?
Expectation sometimes leads to not well or too well, but if we manage well, if we prevent as soon as possible and taking care of ourselves, in the future it will be good and it should be normal. No.
Your health goals, ma'am? Do you have health goals?
Of course, we have health goals, set goals in health. But set goals kasi it's very significant for us to live well, no? In the manner of reading books, feeding our minds, feeding our souls, and feeding our body. So it should be our health, and it should be provided by ours or by us.
Your expectation of nurse, ma'am, or physician?
Expectation to them, I do really have this expectation to them to provide us the highest peak of prevention control when it comes to the diseases. And they provide the quality of care to those people, to those persons that have the illness or the disease.
That's all, ma'am. The health history taking And thank you, ma'am. And God bless.
Thank you.
It's okay.